Hello, class. My name is Audrika Hill, and I will be discussing the points of clinical evaluation in the traditional hospital setting and in the simulation lab. At the end of this presentation, students in the Master's Prepared Nursing Program will be able to identify three objectives: discuss the evaluation method of observation for use in the simulation lab with nursing students, discuss the evaluation of care plans usage among nursing students in the hospital setting, and discuss the evaluation method of observation in the traditional hospital setting with students. We will first discuss the evaluation method for use in the simulation lab. The simulation lab is primarily for the practice of certain skills and procedure that nursing students can perform to build on their confidence and on their skill level. Students are evaluated usually by practicing on a mannequin by a licensed instructor in the facility. The instructor uses the evaluation method of observation to perform things such as head to toe physical assessment. That's just an example of what students can practice on in the lab. They can practice on checking blood pressure, a number of different skills. The instructor will identify the outcomes, or what we call objectives, to be met with an example physical assessment and give feedback on how the student can improve in the skills lab. According to Orman and Gaberson, feedback enables students to reflect on their performance and demonstrate correct procedures when administering care. The instructor will inform the student of the method of evaluation in the simulation lab if it's formative or if it is summative. The simulation lab is a chance to practice skills, so this can be considered to be formative. With the evaluation method of observation, the instructor must remain unbiased since practicing in the skills lab, in the simulation lab, is usually a first time experience. So, first level students will have to build their confidence and build their skills up. Over time, the judgment of the instructor can change if they observe the student not doing something right. This can actually change over time as they continue to work at practicing on skills. And like I said, an example of observation in skill labs is something like checking pupils for light and accommodation, observing how a student can palpate the radial artery, or observing where the student places their fingers on something such as the dorsalis pedis pus. Any observations done by the instructor must be discussed immediately with the student for correction, how they are performing, and like I said, this can help the student increase their skill level over time. The clinical setting is an environment where students can use their knowledge gained in the classroom for application of the nursing process in care of patients. Usually, with the clinical setting, and well, in this situation, the student will have two evaluation methods. One would be to develop a care plan for adult nursing setting. Um, Usually, this is done the day before the student actually cares for the patient, where they go to the hospital setting and they look and just look at the chart and develop a care plan, what we use to care for the patient. The care plan will address the client assessment, patient outcomes, nursing interventions, rationale, and evaluation methods. The value the care plan will be graded based on the development components and application of the nursing process. The instructor will use summative evaluation for student performance while in the clinical setting. Um, this is to ensure that the student is delivering safe and effective care and efficient care of patients. Um, Summative is basically the student will be graded at the end of that session. They'll get a grade for the clinical session on how actually they are performing. An example observation that the instructor can do, like watch the student give correct medication by utilizing the 5 rights of medication rights. Applying the nursing process, such as um, suctioning a ventilator patient. Well, with first level students, we would probably have them doing something a little bit easier, but just correctly, like I said, checking blood pressure measurements. Um, Also, how the student interacts with clients, how they interact with the staff, how they interact with doctors. All of that plays an important role. The teacher will make what is called anecdotal notes about each student as a guide to review performance. These are notes made during this clinical setting that can help determine if there are any inadequacies or if there is a pattern of unsafe care by the student for future use. Notes will then be shared with the student for improvement of performance. Lastly, the instructor will conduct a 30-minute conference. Usually this is done at the end of the clinical setting with all students to share their ideas about the clinical practice, different communication techniques that the students can utilize, and evaluation of the overall clinical experience. What can be done better to improve it? What have the students learned? Students can also take the different perspective of other students to use as a guide for the learning process and to help gain knowledge and build skill level. And this is the end of our presentation of clinical evaluation methods.